Corla. Count Corla, we haven't resourced our ICU as we should. We haven't expanded ICU capacity as required. Even long before COVID, we had staff shortages. In key areas of the HSE, beds closing, corridors full of patients on trolleys, waiting lists expanding. The government have put all their eggs in the vaccination basket and believe so much so in the vaccinations that they're trying to coerce people into taking it. But it makes sense, therefore, that the booster shots are being offered to the 3,500 nursing staff. And I'm not talking about compelling nurses into taking a booster, as they're doing in other countries, but merely offering it to those who want to keep our health service show on the road. I think doing that is consistent with government vaccination policy. It's just a pity it took so long. So in light of the facts presented in this motion, I do support the decision to offer the booster programme to nurses, but equally I do want the government to stop the divisive rhetoric against any nurse, or indeed anyone, who may decide that they don't want to take it. At a broader level, we need to examine why we have issues recruiting the required number of staff to operate our health services as effectively as possible. Firstly, they have to be paid at levels which will encourage our graduates to remain in the country. The working conditions must be such so as to allow nurses to work effectively without being expected to consistently operate for long hours in understaffed and overcrowded wards. We need to ensure too that the paying conditions match what is on offer with competitors, at least, or else it will continue to be a problem. It is with that in mind that the McHugh report needs careful attention. Are we giving our student nurses a good first impression of the Irish Health Service if we're going to expect them to perform frontline nursing activities without pay? It's almost as if the current policy is designed to turn nurses off wanting to pursue their careers in our health service. Only this weekend I met a lovely trainee nurse called Sarah from New Ross at her uncle's funeral. She raved about nursing. She just loved it. She wishes to specialise in respiratory. COVID has not put her off one bit. I was in awe of her enthusiasm, and as she spoke, all I could think was I hope that the system doesn't suck the life out of her. It's clear that it's a vocation, not just a job. But we should be glad, because that's extra dedication that no money can pay for. Ask those patients who have been in receipt of the care and attention that this is not an attribute that government should take advantage of. It's one government should nourish and pay accordingly. I have almost lost count of the number of times I raised staffing issues in the CAMS facility in Wexford. There have been slight improvements, which is obviously welcome, but the fact still remains that the unit is understaffed. And I don't think it's fair to blame any one minister for this. It has been a long-standing problem of mismanagement and cuts to staff's pay and conditions across the board in health service. It means that I have parents whose children are not receiving the services when they can access them. I'm going to continue to ask for this service to be fully staffed until it is. I also raised numerous times that the continued absence of an MRI scanner at the Wexford General Hospital, which the people of Wexford so generously raised the funds to buy. One of the excuses given for not having it installed yet was the staffing issues that needed to be addressed. Well, I'd ask that it be addressed and allow for the $250,000 that the people of Wexford raised be used. In relation to the 24-hour cardiac care delivery in your own county minister at Waterford University Hospital, the funds to ensure that the staff are provided to make that of a 24-hour cardiac care service have not yet been provided. This service takes care of 600,000 people in the CHO department. I don't wish to be dramatic, but each of the above can make the difference between life and death. Not least, as I finally say, this motion calls for the government to ramp up mental health supports. Obviously, I'm in favour of improved mental health supports for nurses in what is a very stressful and pressurised job. But as I stand here and I speak, there is a search operation going on in New Ross area for a young man missing since Wednesday. And this is devastating for his family, but it happens on a weekly, if not daily basis.